Hi, my name is Jason Bachmann, and I'm an 8th grader at St. Clement's School. Have you ever been on a vacation to a beach or a lake? You see, you're probably very relaxed on that vacation, and your blood pressure was probably going down. Now, what if I told you that you could go on a vacation without even leaving your own home? For my science fair project, I studied if virtual reality affects blood pressure. The question was, does virtual reality relaxing scenery affect blood pressure? And my hypothesis was, if people are fully immersed in a relaxing environment in virtual reality, then their blood pressure will go way down because the scenes will be very relaxing. I did some research and I found that blood pressure was highest in ages 60 and up. I decided this was going to be the group I was going to test. I took 20 subjects ages 60 and up. 12 were in their 60s, 7 were in their 70s, and 1 was in their 80s. Each subject was fit with a blood pressure cuff around the wrist. They were instructed to sit for 10 minutes, because 10 minutes is when your blood pressure hits baseline. So after these 10 minutes were up, I measured their blood pressure and recorded it. They were then fit with a virtual reality headset, as shown here. They were instructed to sit in virtual reality on a lake scene for 10 minutes. So after 5 minutes of being in virtual reality, their blood pressure was measured. And after 10 minutes, it was measured again. Now, just to make sure it wasn't just sitting that was making their blood pressure go down, I measured their blood pressure after 5 minutes of being out of the virtual reality. So as you can see here, this graph shows the average systolic blood pressure. Now, systolic blood pressure is the amount of pressure in your heart while your heart is beating. So this was the baseline systolic blood pressure as shown here. And after just 5 minutes of virtual reality, it already went down over 10 digits. And after 10 minutes, it went down even more. Now, just like I said, just to make sure it wasn't just sitting, I measured it 5 minutes after virtual reality, and blood pressure levels went all the way back up to baseline levels. Now, this graph down here shows the average diastolic blood pressure. Now, diastolic blood pressure is the amount of pressure in your heart both in between beats, so like while your heart is resting. So as you can see here, this is the baseline diastolic blood pressure. And after 5 minutes of virtual reality, it already went down over 4 digits in diastolic blood pressure. And it went down even more after 10 minutes. Now, just to make sure it wasn't just sitting, measured it again, as you know. And you can see here that blood pressures, after being out of virtual reality for 5 minutes, went all the way back up to baseline levels and even higher. So in conclusion, my hypothesis should be accepted, because blood pressures went way down while the subjects were in virtual reality. It went down over 10 digits in systolic blood pressure and 4 digits in diastolic blood pressure. So my study directly applies to the real world, because imagine if hospitals and nursing homes had access to virtual reality for patients whose blood pressure spiked due to stress and anxiety. A virtual reality could eliminate the need for additional medications and their potential side effects. Are there any questions?
Were there any outliers in your data?
So that's a great question, and there were. There were 2 outliers in my data. They were both avid runners. So their blood pressure after 10 minutes of being at baseline was at a certain level, and it stayed the same even after 5 and 10 minutes of virtual reality.
Were any of your subjects on blood pressure medicine?
Yes, so 7 of the 20 subjects were on blood pressure medicine, but that wouldn't affect because I was measuring the change in blood pressure. So even if their blood pressure was lowered by the blood pressure medication, even after the virtual reality, it still would have gone down even more.
So their blood pressure went down even after being on blood pressure medication?
Yes, that is correct.
How about the 80-year-old? I'm interested in finding out about that subject.
So the 80-year-old didn't affect the study at all. In fact, even if their blood pressure was high to begin with because of their age, it still went down just like the blood pressure medication. I was measuring the change, not how high it was to begin with. And your blood pressure gets higher when you're older because the elastic tissue in your arteries shrinks, making it harder to pump blood. So that's why the blood pressure was higher in the 8-year-old.
All right, very good.
Thank you for reviewing my study, and yeah.